And again, we'll get started promptly at 3 o'clock, so we've got another couple minutes.
Hello?
Hi, can you hear us, Patricio?
This is Patricio. Can you hear me?
Yes, we can hear you. Can you hear us?
I can't hear you from here. I can't hear you from the computer. I think I gotta.
Just, you might want to check and see if the sound on your computer is muted, Patricio. And for folks who are using the web feature, if you could type in your first name and last name, rename yourself so that we can have a better idea of who's talking.
Hello, Heather. Just checking. Can you hear me, you guys? Can you speak to me so I can hear you?
Can you hear us, Patricio?
Yes, I can. So I'm not going to use the headset, so I'm going to just use the laptop. So it's okay.
All right, great.
All right.
But it's 3 o'clock, so we'll go ahead and get started. I'm sure folks will continue to trickle in as we go through introductions. But if you haven't already, if you could just enter in your name and organization and email in the chat box. And also we try to make sure everybody has the same naming format in their little box. So if you wouldn't mind putting in your first name and last name, if there's more of you in one room, you can just put your first names, and that'll give us an idea when folks are talking, who's doing the talking. So thank you all for calling in. This is Project Echo, Cancer Patient Navigation. Today's topic will be a continuation of last month, so we'll continue the discussion on financial toxicity. To just go over a few ground rules before we start, please make sure that your phone or your microphone is muted when you're not talking. And if you are called in, just make sure you don't put us on hold. If you have video capability, please use that. It makes it better sense of community to see each other's faces. And we don't always like to be the only one on screen. So thanks so much for those of you who are using your video. If you don't have access to a video, we are happy to help you purchase one or troubleshoot that. So if you want to email me after the meeting, we can help you with that. Just a reminder to never disclose any protected health information through HIPAA if you're talking about patients or patient case studies. We want to make sure that we keep everybody's information private. If you'd like to say something, you can raise your hand physically, use the click option in Zoom, or you can always message us in the chat box, and we'll be sure to raise that to everybody. When you're talking, just make sure that you're speaking loudly and clearly. If at any time you all can't hear us, feel free to enter that into the chat or just shout out and let us know. And again, today's topic is financial toxicity, so if we can please just keep any questions and comments related to that topic, that would be appreciated. With all of our echoes, we start by doing introductions with everybody who's participating, so just your name and where you work. And then we'll have an educational presentation today by Torie, Lavoie and Annabelle Harcourt. And then we'll hear our case study by Patricio and Massanga and have time for questions. So we'll go ahead and get started with introductions. So I'm just going to stop sharing my screen for 1 second so I can see all our little boxes. We'll start with, how about Torie and Annabelle? You guys, and you're still muted.
Torie Lavoie, Financial Advocate Manager at New England Cancer Specialists.
Annabelle Harcourt, I'm a financial advocate at New England Cancer Specialist.
Thank you, welcome. Patricio, would you like to go next? Oh, and you're still muted too.
Sorry, guys.
That's okay.
Sorry, I didn't realize I have to unmute. All right, my name is Patricio Massanga, and I'm the patient navigator here at Greater Portland Health.
Hello. And Magda, does your group want to go next?
Hi there, yes. Magda Alden, American Cancer Society Patient Navigator at Maine Med, and...
Hey, it's Mandy Ortega, Navigator with Maine Health.
And Amber O'Leary, Patient Navigator for Maine Health. There we go.
Hello. Welcome, everybody. We have Caitlin Humphrey, too.
Hi everyone, Caitlin Humphrey from Cary Medical Center. I'm an oncology nurse navigator.
Welcome. And Terry Priest, would you like to go next?
Yes, I'm Terry Priest. I'm the oncology clinician at the Harold Alphons Center for Cancer Care in Augusta, Maine.
Welcome. And we have Carrie is also on the line.
Carrie Medeiros, Oncology Nurse Navigator for Lung, and Coco's here too, and she navigates head and neck and survivorship.
Thank you. And can you remind me of Coco's last name?
Brown. So it's actually Nicole Brown.
Thank you. And Heather, do you want to go next?
Sure. I'm Heather Ciccarelli. I'm with the American Cancer Society. I'm the Senior Manager of Patient Navigation for the northern part of the Northeast region.
Thank you. And just, Heather, your voice is coming across a little soft, so if you want to speak up a little louder next time, that would be great. But I think, did you capture that? Okay, but we got your name and your information, so thank you. And then we'll do introductions for folks who are in the room.
Sure. Hi, my name's Aisha Sheik, and I'm the Director of Programming here at Maine Cancer Foundation.
And I'm Caitlin Michaud. I'm a Program Manager at Maine Cancer Foundation, focused on our grant making.
And I think most everyone knows me by this point. I'm Heather Drake. I'm also a Program Manager at Maine Cancer Foundation. And if you have any questions, you can always reach out to me and I'll be able to help answer them with relation to Project ECHO. So again, just a reminder, we are recording this session and that'll be available afterwards. We'll put on our website along with the presentations and case study recommendations from the day. So Torie and Annabelle, if we're ready, we'll go ahead and get started. And I can bring up your slides and just let me know when you'd like me to move forward.
Hi, everybody. Hi.
Hello. Can you see your slides?
Okay, yes. So learning objectives, I feel like we're going over a lot of stuff in just a few slides, so bear with us. We kind of just wanted to have bullet points on what we're going to go over, and we'll get more specific on each one. But how familiar are you with accessing financial assistance for cost of treatment or non-medical grants for patients in treatment? How familiar are you accessing medications to underinsured or uninsured patients? Are you aware that there are other financial resources available to support patients and caregivers? So what we face a lot here is what happens when you're diagnosed with cancer and all of a sudden your income has changed, sometimes by 100% if you're self-employed, don't get disability benefit, short-term disability, but your bills stay the same. Patients face this question every day and are sometimes mentally paralyzed by it. Due to their diagnosis, they may have to be on short-term or long-term disability, which in turn has them making less money. They have to leave their job altogether due to diagnosis and treatment. Although living expenses all stay the same. They still need to pay the mortgage, electricity bills, put gas in the car, food, co-pays, it just goes on and on. Now they do it with limited income, if any. So the question becomes, is there assistance for non-medical bills as well as medical? So starting out with some of the foundations, I'll have Annabelle go over some of the foundations, and her and I are going to just toggle back and forth between these.
So the first couple of slides are more geared towards non-medical assistance. First one, Leukemia Lymphoma Society. They actually have quite a few different aids that they give, and some of them don't even, it doesn't matter if you're insured or not. They have the Urgent Needs Program. They have travel assistance. They also, here in Maine, have a grant right now, and they actually just got funded again, right? Mm-hmm. So that they'll give $500 reward to the patient. Once again, does not matter if they're insured or not.
And that is a check that actually gets mailed to the patient, made out to the patient's name. So it doesn't have to go to a specific, doesn't have to go to CMP, or doesn't have to go to New England Cancer Specialists or Maine Medical Center or wherever. It goes to where they see fit. And that is a one-time every 12 months. It's not a one-time deal. It's every 12 months as long as that patient's in treatment or follow-up. Next slide.
So a couple other of our nationwide foundations do offer some transportation assistance, and that is geared towards a diagnosis, like ITP for the PAN Foundation. And you have to submit a couple of different documents showing when they're coming for treatment and how often, but they do help with travel assistance. Cancer Care has one as well for specific diseases, once again. And you have to show their schedule of treatment to prove that they are in treatment. You want to take this there? You can go. So American Cancer Society also has the Road to Recovery, helps coordinate different rides with volunteers or with local organizations. One of the local organizations that they might use is RTP, and which provides the low cost of transportation. And I know Magda at least helps us with
call Magda.
Yeah. With scheduling patients of ours that have main care with logistic care and things like that. She helps with. So
thank you, Magda.
Yeah. Couple of, once again, more nationwide is Project Purple, which you have with a pancreatic. These are more disease specific, but help with non-medical bills. Project Purple also does help with medical. There's the Smiley Wiley for breast. It does close pretty quickly in the beginning of the year. This year's is closed, so we would have to wait until 2020 for it to reopen. So Maine Breast Cancer Coalition, they will help with oil, they'll help with food gift cards, transportation costs. They also do help with medical bills. Their reward just went down to $400, and that's every 12 months. You submit the application, they look at it. If it's a medical bill, it gets billed straight to that provider. The Bob Smiley Memorial Fund is one here in Maine as well. And it's a smaller fund, kind of still gearing up. They don't have a specific website. They have a Facebook page, but they will help with non-medical and medical expenses. And then even if you just need a break from cancer, you just don't want to think about it even for an hour, they'll give an experience. I'll let you take Foundation for Love since you're on the board for that.
So the Foundation for Love was founded by two sisters. One is a oncology nurse and one had battled triple negative breast cancer herself and is currently in remission. And they offer experiences for patients. Many times they've done sporting events tickets, you know, a limo down to the Red Sox, tickets for the patient and their family, local sporting events, spa days, dinner out. They've done airplane tickets for patients to kind of get away for a weekend, train tickets to New York, Boston. We just did a Socology for a patient and her family to go and have that experience. So just something to get your mind off cancer, off the bills. We're trying to help as advocates as much as we can to take the financial burden away, but that still leaves them still thinking about everything, still thinking about their diagnosis, treatment, family, finances. So Foundation for Love is there to kind of help take that away for a day or a few hours. And that's a great organization. Local social workers, huge resource.
Yeah.
Huge resource for all of this. We end up working with them quite frequently to make sure we're not duplicating any of these resources, but sometimes they can think of something that we haven't, or vice versa, and it's just so important to keep the social workers involved with the patients that we're having to access resources for. I think everybody's familiar with the Joe Andruzzi Foundation, which is now closed until September 1st, I believe. But that's a one-time grant up to $800, and they help with anything basically within reason that's non-medical. Simple Gifts is another organization that is local that offers, most of the time we get a lot of gas cards from them, but they will offer other things that are needed on a case-by-case basis. Food cards, Walmart cards, help with utilities. Everything is a case-by-case, and you have to request it individually, but it is mostly a Hannaford or a gas or Walmart card. So others that we have thought of that don't usually come right into your mind right away. We've had some local institutions come in and say, make sure that every patient checks with the bank that they use. Many times these patients actually have disability insurance built into their loans, whether it's a mortgage, car. I don't think they do for personals, but anything that's a secured loan, many times they have disability built right into it. So if they do go into short-term disability and their income has changed, that insurance will actually start paying for that payment for them for as long as they're on disability. So again, many patients don't even know they have that. A lot of the banking institutions as well will offer short-term loans to help them through their treatments, and sometimes can revamp their current loans if they don't have insurance on it to help keep it current. As long as they're paying a smaller amount, they can work around that for them. Of course, your local town, sometimes the towns have funding. I know that you pretty much have to be destitute in order for the towns to help. But that is still a resource for some patients that really need that assistance. DHS, of course, here we do help, well, we actually apply with the patient, email the applications over with financial information, with clinical information, and follow that application through upon completion. And obviously, if they qualify, they can get help sometimes with food, rides, things like that. And obviously they'll backdate upon diagnosis, to backdate to diagnosis if they're financially eligible as well. Utility companies, sometimes they will let you defer a payment without penalty. A lot of these utility companies won't. Sometimes we can just reach out to organizations to help pay those bills instead, but hopefully they can help defer. And obviously 211 Main for your basic needs. Go ahead.
So Amtrak has kind of partnered with a lot of the medical places, at least that I know of, and has given discounted tickets for what is called the Down Easter that can get them down to Boston, because you have a lot of patients that have to go down to Boston for treatment, transplant, things like that. So it's at least a discounted ticket. It's not as much, but every little bit helps for a patient in need. Then you have the Dempsey Center, which offers classes not only to the patient, but the caregiver as well, and healthy eating, yoga, support groups, and just, I mean, even if you're in a different state, I'm sure there's another facility like the Dempsey Center. It's always just looking out, but for us, we rely on the Dempsey Center here in Maine.
Now we jump to more of the financial ends of things with help with treatment costs. And I won't go through all of these, but anytime a patient has a commercial insurance, no Medicare, Medicare Advantage, main care, nothing like that, anytime there's a commercial carrier, we always look to see if there's a copay card. Most of the time there is. And if it's something that we're not super familiar with, we just go right to that manufacturer's website and try to see if there is a copay card. But these copay cards will many times cover the entire copay of the drug cost, or allot somebody a $5 copay. So these are invaluable to patients. And many times, I mean, there's one that doesn't have an end date. Genentech will not have an end date on their copay cards. They just kind of go until the treatment has stopped, whether that's 6 months or 3 years. A lot of these end dates are 1 year, sometimes longer, and it's important for these commercial insurers, these patients, that when they come in for treatment, say if it's right now, these patients have met their out-of-pocket, it's important at that time for us to still secure that copay card, because come the new year, that patient could be slammed with another $5,000 deductible, and if that gets missed, then that patient will be out that money, whereas we could have had that already in place. So here's just an example of the ones that we use all the time. And for last year alone, for New England Cancer Specialists, we hit almost $2 million in copay assistance. So it is a lot of money to be had for these patients. And no income cap, like the grants, there is no income cap. So we have many patients that think they never even would qualify for assistance until we meet with them and go over all the stuff. I mean, no cap whatsoever. So patients can, you know, be in the hundreds of thousands and they're still qualifying for assistance. So I won't go through all of these separately, but they do have links attached. And a lot of these foundations will backdate. So these foundations, anytime a patient has an out-of-pocket here, we meet with that patient and we try to get as much assistance as possible. We prefer to see if that patient can pay minimal amounts. If we can get it all covered, that's our ultimate goal. So we go for these foundations. We've started with a new system called TaylorMed, and this system alerts us when foundations do open, and all of our patients that are in treatment are in this database. So if a patient comes in today with non-small cell lung cancer, as we know, there's hardly funding for that ever. And they're getting a hefty treatment, and it's, you know, they have a $7,000 out of pocket. Well, that patient will be in this database, and when the fund opens, TaylorMed will then alert us that the fund is open and alert us with all the medical record numbers to tell us who to go into and grab these funds for. And of course, a lot of these foundations will backdate. So hopefully we can get, you know, that kind of coverage for these patients, even if it's not open at the time of diagnosis.
So here at New England Cancer Specialists, we also try to do a couple of things on our own that will help our patients. We, on Fridays, are able to wear jeans if we pay $2. That $2 then goes and gets put into Hannaford cards, Walmart cards, gas cards, things like that. And every once in a while during our year, we also do have a specific month that's just for a patient or a family of patient that had passed. And so we then help. We just try to find what we can do to help as much as we can. So if you wear jeans on Friday, Torie or I are looking for you and asking for your $2 so that we can then continue to help our patients.
And when all of these, if we can't turn to foundations or if we can't turn to copay cards, things like that, obviously we help the patient with financial assistance within our institution, qualify them for financial hardship, qualify them for local hospitals. We work with a few different hospitals and we work with their free care program to see if they can get free care, and also free drug. We got over $3 million in free drug last year for patients that could not afford treatment and that there was no assistance available, or they were uninsured and could not get insurance until open enrollment.
All right, thank you so much for your presentation. We'll take a few minutes for questions, but I did want to recognize that it looks like Beth from Sebastica has joined, as has Cherry from Dartmouth. So thank you both for calling in. Does anybody have any questions for Torie and Annabelle? You can either say them out loud or if you want to come through the chat.
Are you going to, can you hear me?
Yes, we can hear you.
Are you going to be sending out a copy? Because that was a lot of information, really good information. I was trying to write it down, but then I figured you must be sending something out after the meeting.
Yes, I will send a copy of the presentation to everybody, and I'll make sure that those links work.
Okay, thank you.
Yeah.
So just so you know, on the PowerPoint, all the links that are the pictures that are the logos for on the first couple of slides are links to the website, just so you know.
Thank you.
And I want to add one more thing. I'm sorry. We could think of 100 more things. But we have partnered 3 years ago with the Good Shepherd Food Bank. And so we're working on a grant with them, and we keep emergency food bags here for patients, for indigent patients that can't afford to feed themselves and their families. So upon check-in for their symptom checklist, we have 3 questions regarding food insecurities. And if they screen positive, we automatically give them a food bag and meet with them to see what else is going on.
Thank you.
I have a question. This is Tracy. The Foundations for Love, how do you access that for patients?
It's on their website, foundation, the number 4, love.org, and the application is right on the website. Was that link on there? The link is on there on the PowerPoint.
Great, thank you.
Are these only for Maine residents, or is this for like our patients that are treated at Memorial Hospital also in North Conway, New Hampshire? Do you know?
I can't hear you.
Oh, is this just for our Maine residents, or is this for also the New Hampshire residents that go to Memorial Hospital? Do you know? Is it state specific on?
Oh, it's not state specific, no. So they're getting treatment in Maine?
No, so some are, like I'm a navigator also at Memorial Hospital in North Conway, New Hampshire, part of Maine Health.
Yeah. They were qualified to apply.
Okay, great.
Yeah. Sorry, it's not coming in very clear.
We have one more question.
Hey, this is more of a question for the crowd. I was just wondering, all of this is really awesome, and I know I've used a couple of them, but it just occurred to me that some of this might, is any of this taxable income for patients? I just think about financial thresholds and stuff like that. Anybody have any ideas about that? I know some of them kind of ride the line.
Can you, for some reason, you guys are sounding a little robotic. Would you mind chatting in the question? And will you guys type? We'll see if anyone else has any questions. And also, if we happen to not get to a question, we can always follow up afterwards.
I have a question.
Yes, Patricio.
Oh, not even a question, but following to the presentation, what I realized that many foundations that they cited on the presentation, they are more for reactive assistance. So is there anything like can be proactive, like before people they get to those stage, how to assist people before they get to that stage? I know that Maine Cancer Foundation is working for increasing the rate of cancer screening, but what I realized there are not much like a foundation that assist people to screen before they get to those stage to look to seek for those assistance they listed in the presentation.
There are.
Oh, sorry.
There are a couple of grants for the testing, but as far as but it's very limited as far as like genetic testing and things like that. There are a couple of those grants on some of those foundations to help with that testing, but as farther than that, I don't know of any.
Do you mean like colon screening, breast screening? That
Yes.
kind of stuff?
Actually, it will be one of my topic. I will talk later about that. People being reluctant because they have they will have to pay a lot on things that they think they're not sick, they don't have any symptom at all, but they're getting charged bills. So it's like
we don't see a lot of the screening per se, because by the time they get to an advocate here, they're already diagnosed with a cancer diagnosis. So we're past the screening point. But once, say, a breast care patient maybe we got that patient main care, and then now they're 6 months out in remission, still 6 months out from treatment, they can kind of move from that full main care benefit over to the the cervical screening, that program. Other than that, I don't know of any other screening programs, so to speak, for other diagnoses.
Okay.
I have some information.
Okay.
On the colo screening. We're currently in a program right now through the Maine Cancer Foundation. We're reaching out to patients that are due or overdue for screening colonoscopies. If they are uninsured, then they have to first apply for main care. Once they do main care, approved or not, then they can apply for the financial assistance program through whatever facility they choose to go to for the colonoscopy. So, and we work really closely with the patient. So if they do end up with a balance that is left to them because they're over income, then we will work with them and make it as easy as possible, just to make sure to remove those financial barriers for them.
Okay.
This is Aisha at Maine Cancer Foundation. I am reading the question that came from Manny. So he is asking whether financial awards to patients, whether that's considered taxable income. Do you know whether it is?
Are you talking about copay assistance, or you're talking about the extra grants that go for like experiences?
Extra grants. Sorry, I'm just reading in the chat box.
I do not believe that is. I can find out for sure, but no, that wouldn't. Yeah, no. Okay. I can verify, but no. I'm 99% certain. No.
Okay. Thank you.
And I don't mean to cut off questions. We'll have more time for discussion, but I want to make sure Patricio has a chance to present. He already alluded a little bit to what he will be talking about with his case study. But I will bring that up. So Patricio, if you want to take it away and talk about your case. We also have some of the information on the screen too, so folks can see it, but I'll turn it over to you now.
Okay, thank you. As just a background, so I'm a patient navigator. So I am. We have a grant here from the American Cancer Foundation where we have the duty to outreach our population in terms of ages or genders. Those are have to do some certain screening like breast, cervical, and colon cancer. So I've been outreaching people. It's started since March. I started to outreach people. So when Heather came to me and solicited me if I had something to speak, so this came up in my mind about those challenges I've been facing on people that who are uninsured, and we are recommending them to do those screening. So we're happy that there are some people before even we reach them, they already been recommended by the care provider to do those screening, and they didn't know the system at all, so they end up with bills in their hands. So by the time I contact them back to go outreach, to go screen for other cancer screening, and then they've been complaining that I've already been, for instance, recommended to do the breast cancer screening, and I ended up with my bill, and now you're telling him again to do the colonoscopy. So it's kind of it's been like a question for them. So they think that some of them, if they weren't unsure, they used to be with free care. So when they start to work, they didn't know how the system of our insurance work. So this is coming second slide, actually. So they thought that, like in our country, when you have an insurance, the insurance company cover everything when you have a treatment. But it's different from here. So many people, they are surprised having bills in their mailbox with the screening they did. And they've been very frustrated. And chiefly when they didn't find anything and they're paying bill on things, they think they were okay, but they were told to do so. So it's been a kind of now as a barrier for me now to get them to do other screening other than what they've been recommended before. So it's been very challenging. And right now, I've been working with them to explain them, because there are also many newcomers here in the United States that they don't have this culture to do the screening, because we come from countries where the hospital is there just when you're sick. It's not for proactive or to do we didn't have primary cares where we came from. So now when it's come that you have to go spend money when you don't feel that you have some symptom, it's been very hard for me to do my job.
Hello?
Yeah, can you hear me?
I can hear you. This is Beth. I'm a patient navigator with Northern Light, Sebasticook. Do you ever sit with patients and complete main care applications?
So what actually happened, we have people, we have this handout from many places. For instance, a month ago, I had a lady, I called for her to do the colonoscopy, and then she bounced back. She told me, "You're telling me to do the colonoscopy. I already have here. When I was at DHSS, they gave me the handout recommending me with my age to do the breast cancer." So I had my primary care to help to set up my breast cancer. So when I went to do the breast cancer screening, and now I'm charging, I was charged for some bills, but from DHSS, they told me it would be free. So those handouts, they receive it in several places, but when this information is received by myself during the outreach, I explain them with the very language. Right now, I'm getting some people to come here to call together the main breast and cancer program so I can assist them in terms of the literacy to help them to call. But there are other people, they get it somewhere else, so I cannot assist on this.
Maine Breast and Cervical, they have a really good program for mammograms and for other testing as well. It's really easy to apply. They can apply right over the telephone with them. And they do not need to prove income. They just need to state what their income is. And the income level is pretty high for that program. So that might be a good place for you to start with the breast screenings.
Yeah, exactly. So this is if the patient is receiving these information through us, we help, because I actually help them in terms of other languages translation. I've just spoken today with the director of this program. So there is actually a translation line, but for the person to get to there, initially she has to know, she has to hear some instruction in English so he can get to the to her specific language that she can do that. So it's a barrier there.
Oh yeah. I wish I could help you. We're so far away from each other.
So with our patient, those are outreach, what I've been doing right now, or I can go down to one of our clinic that is in Portland at Park Avenue, or if somebody is close here, I call the patient to come here, then we call together. I facilitate as a translator. So that's where we can move forward.
Good, good.
Any other question?
Yeah, so I put up some of the questions that Patricio has on the screen so folks can see them. But if people have ideas, specifically, I'm thinking how others might work with their financial departments around insurance, and if there's any sort of screening processes there at your institutions. If it's just, okay, they have health insurance, move them along, or is there a way that you can maybe assess that even if you have health insurance, you might need help navigating that?
Yeah, we actually get the patient to see the financial counselor here. We have a big team of a financial counselor. But actually the thing is that the person, they know that even though I have the insurance, but I still gonna copay, and it's not. This is a particular example. It's happened for myself. That first time I was recommended by my provider to do the screening for liver cancer. So I didn't know at that time, coming from free care with my new health insurance. So I thought it would be the same. So, but when I went to do this, at the end of the day, I'll get charged over $600, and at the time it was hard for me to pay that, because I didn't expect that. It came from nowhere. So, and many people there in this kind of situation that they have bills in their hand now, they are struggling to pay them. They thought that insurance would pay them. It used to be with free care. So.
And maybe that's where some of the foundations that were discussed in the presentation might help with the copays potentially.
Mm-hmm. Yeah, I saw that valuable information, but people don't know them. Those foundations, many people don't know them. It requires somebody to tell them.
I can tell you that here at New England Cancer Specialists, before a patient is treated, if they have an out-of-pocket at all, they do meet with a financial advocate prior, and we go over the cost estimate and what the insurance will cost estimate for the chemo, and what the insurance will cover and what their portion will be, and that's when we try to get it covered. And if we can't get it covered for whatever reason, we then have to at least get a down payment, preferably, and set up a payment arrangement. And then once we set up the payment arrangement, our billing department then follows that payment arrangement through on a monthly basis.
Exactly. Many patients have been explaining with local languages to explain them how the system works here. Because sometimes when people they see, boom, this is 800, she thinks that she has to pay 800 once. But now I've been explaining them that it doesn't mean when you have 800 you have to pay that at once. You can pay this gradually. Depends on how you're gonna set it up, and then they feel now it's a little bit lighter than as they think.
This is Aisha. I have a question for everybody. Whether your organization uses a kind of financial screening tool. I know Torie just mentioned anybody who has an out-of-pocket expense, but do any of you ask questions like, are you struggling, or about food insecurity as a way of like flagging patients who may need extra help?
Well, our food insecurity program, we would automatically be flagged, like I said. And then if somebody has an out-of-pocket, we would then discuss finances and see if anything was needed. And then we would, if somebody's covered at 100%, we typically wouldn't bother that patient, so to speak, unless there was a need brought to somebody's attention.
This is kind of a funny detail, but do you flag them using like a paper chart, or is it in an electronic medical record?
So we would get an actual task from somebody into the electronic medical record. Therefore, it would kind of stay in that chart. And if somebody needed to go back and look at whatever was messaged, then they could see that and our response.
Great. And Magda's group, I'm not sure if it's exactly Magda or one of her coworkers there, just wrote in the chat box that the navigators at Maine Medical Center's Cancer Institute do an intake and ask if people have financial or insurance questions, and then they get referred to a social worker. Thanks, Magda.
Does anybody have any other recommendations or thoughts for Patricio, or just questions about the presentation, or any other cases, things that they've been struggling with that they might want help with from the group? Open it up now.
Hi, it's Caitlin. As we have like a fairly new navigator program, and my question is, like, if you, I know Torie and Annabelle had mentioned like how many like thousands of dollars they've saved patients. Like, do you have a way of like tracking that to show the potential of having a financial advocate to kind of show that? Do you have a tracking system, or?
Discussion.
Whoops, go ahead.
Is this my question?
Oh, no, this is for Torie and Annabelle.
Okay. Yeah.
Thank you.
So we've been doing it manually, believe it or not. So most of these numbers that we're getting, we are actually entering all these foundations as an insurance set in our billing system, so that when these payments come in, we can track it that way. Free drug, we kind of log on our own, but with this new TaylorMed system that we're using, that's supposed to be able to track all of our numbers for us. And then as we grow, because, you know, unfortunately in this industry, the consults are still coming in, and it's very busy, and there's a lot of patients. So this is supposed to be tracking those numbers for us and kind of proving additional financial advocacy positions for the future.
Okay, great. Because I think if you had shown, like, if somebody actually had the time to sit down and kind of do all of, you know, look for funding and see what patients are having to pay out of pocket and things like that, I think it would definitely be worth it to have an actual person to do that and help them apply for insurances that cover more and things like that. So thank you.
Agreed. Yeah.
I use the spreadsheet as well. It's very manual though, but it's something to give to the CEO to show the value of the program.
This is Aisha again. I'm just translating for Magda Alden's group. She mentioned in the chat box that she's joined the ACCC, which has a lot of conversations about tracking systems for financial navigation. and she is willing to show you some of the threads.
Awesome. Love to see it.
And Carrie Medeiros, I'm going to single you out. I know you do a lot with metrics and tracking. Do you do anything specific to financial tracking?
No, we don't. But I know our organization does keep track, but I don't know how they do it, of how much they've saved patients. It's probably manual because we don't have any kind of software program to do that. And when I've gone to other conferences too, it always pays to have a financial counselor or a financial navigator. They're usually able to have that person's salary paid and then some. In fact, like we went from one financial counselor to two here because the amount of money they were not only saving patients, but the organization.
That's great, thank you.
This is Aisha again. I just wanted to get back to Patricio's case study and mention that there's a group called the New Mainers Public Health Institute based in Lewiston that's working with their community to provide kind of like cancer prevention 101 classes and then build a bridge from those classes to primary care providers for basic cancer screenings. So it's an opportunity for the group to come together and talk about, let's say, breast cancer risk, and then they work all together as a group to move patients towards appropriate screenings. So if anybody has interest in learning more about that program, maybe if not for your own patients, but as a model for your community, please let us know.
If you can give me some information, more information offline, I would appreciate it.
Absolutely.
Any other questions or thoughts on today's topic? Okay, well then I guess we'll wrap up a little early. We were a smaller group than normal, so that's probably why. But I want to thank everybody for calling in. We will meet again on August 28th, and that month's conversation will be on transportation. So getting people to their screenings or treatment, other places as well. So if you have a case study, we really encourage you to submit them. We can take as many as the hour will accommodate. So if you're, have a patient that's struggling to get where they need to go, please reach out and we can have your case presented and troubleshoot together as a group. I will send a follow-up email tomorrow with the post-assessment, so please fill that out and we can enter you in to win that LLB gift card. And then I will also post a recording of this presentation to Maine Cancer Foundation's website, which is mainecancer.org, and I'll send the presentation out and post that online as well. But yeah, so that's it. Thank you all so much for calling in again today, to Torie and Annabelle and Patricio for all presenting and for everybody for your great feedback.
Thank you very much.
Yeah, thank you. Have
Bye.
a great day.
Thanks. Take care.
Bye.
Bye.